Hello everyone, I am Dr. Raghu, and today we are going to look at something you probably see every morning but rarely pay attention, which is that your tongue. Did you know that your tongue can provide important clues about your overall health? Changes in its color, texture, coating, or shape may be associated with dehydration, vitamin deficiencies, infections, diabetes, anemia, and in some cases, more serious conditions. Of course, a tongue change alone does not confirm a diagnosis, but it can early sign that you should seek a medical advice. Yeah, let's begin. Let's understand what your tongue may be trying to tell you. What does a healthy tongue look like? A healthy tongue is a usually light pink in color, slightly moist, and covered with tiny bumps called papillae. It should move comfortably without pain or difficulty. There should be no thick coating, persistent ulcers, or unusual swellings. Any change that lasts more than 2 weeks deserves medical evaluation. White tongue. Should you be worried? Yes. If your tongue develops a thick white coating, there are several possible explanations. It may occur due to dehydration, poor oral hygiene, smoking, fever, or certain medications. Sometimes it can also be caused by a fungal infection called oral thrush, especially in people with diabetes or those taking antibiotics or steroid inhalers. If white patches cannot be scraped off persistent for more than 2 weeks, you have to consult a doctor or a dentist for that. Bright red tongue. A smooth, bright red tongue may indicate vitamin deficiencies. What are those? Particularly vitamin B12, folate, or iron deficiency. Some people experience burning sensation or altered taste along with redness also. Certain infections and inflammatory conditions may also produce red tongue. Simple blood test can often identify these deficiencies. Pale tongue. Is it a sign of anemia? See, if your tongue appears unusually pale, it may be associated with low hemoglobin levels or anemia. If this accompanied by fatigue, dizziness, weakness, or shortness of breath, you should seek the medical evaluation. See, iron deficiency remains one of the most common causes worldwide for the pale tongue. Crack and fissures. Many people naturally have grooves or fissures on their tongue. Most of the time, these are harmless. However, food particles and bacteria can become trapped inside these cracks, leading to bad breath or irritation. Maintaining good oral hygiene and tongue cleaning is usually sufficient for this. Burning tongue syndrome. A persistent burning sensation in the tongue can be frustrating. Possible causes include vitamin deficiencies, diabetes, acid reflux, dry mouth, hormonal changes, and sometimes anxiety or nerve related problems. Persistent burning symptoms should be always evaluated by a healthcare professional. Black hairy tongue. This condition often looks alarming but is usually harmless. Tiny papilla becomes elongated and traps bacteria, food pigments, and dead cells, giving the tongue a dark, hairy appearance. Smoking, excessive coffee, antibiotics, and poor oral hygiene increases the risk. Most cases improve with proper tongue cleaning and oral care. Ulcers that don't heal. Is it a serious warning? This is one sign that you should never be ignored. If you have a mouth ulcer that lasts more than 2 weeks, especially if it is painless, hard, or associated with a lump, you should consult a doctor immediately. Although many ulcers are harmless, persistent ulcers require evaluation to exclude oral cancer or other serious conditions. Early diagnosis significantly improves the outcomes. Scalloped tongue. If your tongue has impression from your teeth along the sides, it is called as scalloped tongue. This may occur due to tongue enlargement, teeth grinding during sleeping, sleep disorders, or nutritional issues. It is not a disease by itself, but may indicate an underlying problem that deserves attention. So, your tongue is more than just an organ for test. It can be an important indicator for your overall health. Remember these key points. Mainly, persistent white or red patches need evaluation. Pale tongue may suggest anemia. Burning sensation can indicate nutritional or metabolic problems. A non-healing ulcer lasting more than 2 weeks should never be ignored. Most tongue changes are treatable and many are harmless, but timely medical advice is always the safest approach. If you found this video useful, please like, share, and subscribe. For further simplified medical science and practical health knowledge, subscribe. Thank you. Signing off, Dr. Raghunaran. Bye bye.